Hello, everyone. Welcome to today's webinar, Achieving Empowered Care for HER2+ Breast Cancer at Patient Town Hall. This educational activity is provided by Prime Education in collaboration with Novellia and is supported by educational grants from AstraZeneca Pharmaceuticals and Daiichi Sankyo. Our expert faculty presenting tonight's webinar is Dr. Reshma Matani. Dr. Matani is a medical oncologist practicing in South Florida. She serves as Chief of Breast Medical Oncology at the Miami Cancer Institute, Baptist Health South Florida, a Memorial Sloan Kettering affiliate. Now, before turning the meeting over to Dr. Matani, I'd like to quickly go over the first few housekeeping slides. This slide indicates how Prime reviews all disclosures of relevant financial relationships and resolves any potential conflicts of interest as part of its educational planning process. This slide includes all disclosures by our faculty. Please note that the first part of the program will be breast cancer education led by our expert faculty, Dr. Matani. Then during the last 15 minutes, we will have Novellia introduce a new program they have developed for patients. Make sure to stay on for the entire session so you can hear more information about this enrollment opportunity. This session is designed to be interactive. Please utilize the chat box to submit any questions or comments throughout the presentation. Please submit your questions or comments in the public subtab. This will be seen by all attendees and the presenters. Poll questions will also pop up on your screen throughout the webinar, and we encourage your participation. On the left side panel, you will be able to see the polling results once the poll has ended. At this time, I would like to hand it off to Dr. Matani to move forward with the presentation. Thanks.
Thank you, Jill, and thank you to the team at Prime for the opportunity to participate in this important meeting, Achieving Our Care for HER2-positive breast cancer. So let's get started. This program is meant to be interactive, and you do have the opportunity to ask questions. We're going to try to pepper in some questions throughout, and then also put them in the chat, and Jill will kind of feed them to me. I'll also make sure that I finish the slide presentation in time to have some open dialogue and questions come through the chat. So let's start with understanding my diagnosis. So here's some information that you may all be aware of. It is about the incidence of breast cancer. I think the first step is to just understand that a breast cancer diagnosis can be overwhelming, but unfortunately, this is a situation that many women face. You're not alone. There are an estimated over 300,000 people who will be diagnosed with breast cancer in 2023 in the US. And some may be surprised to hear that the incidence of breast cancer is actually on the rise. But fortunately, death rates and mortality, as we call it, has steadily declined. A lot of that has to do with our improvements in diagnoses, diagnosing breast cancer at an earlier stage. And it's important to recognize that diagnosing breast cancer at an earlier stage equates directly to a greater chance of cure. If you're diagnosed with a stage 1 breast cancer, your chance of actually being cured is north of 98%, 98, 99%. Many of our patients are doing very, very well. Of course, a later diagnosis can impact the cure rate. And most of these cases are actually women, but about 1% of all the cases are men. And more often, when a man develops breast cancer, we think of an inherited gene mutation or a genetic mutation that may have impacted his risk. But there are men that can develop breast cancer even in the absence of a genetic syndrome. So here's a slide that shows us in a pie chart the different subtypes of breast cancer. And it's important to recognize that breast cancer is not just one disease. There are various subtypes of breast cancer. There are characteristics of the tumor that help us not only understand how aggressive that cancer is, but also directly link to the treatments that we're able to offer you. So the most common type of breast cancer is the part that's shown here in pink, 69% hormone receptor positive, HER2 negative. So hormone receptor positive refers to the tumor expressing estrogen and or progesterone receptors on the surface of the cancer cells. And that's sort of indirect evidence that the tumor grew under the influence of these normal female hormones, a hormonally driven cancer. Then there is a subtype of breast cancer called HER2 positive breast cancer. Approximately, it says here 14%. It's really depending on the series, somewhere between 14, 15% up to 20%. So about 1 in 5 cases, there will be too many copies of this gene called the HER2 gene, which makes a protein in the cell, and it makes the cancer more aggressive. It's a more aggressive subtype of breast cancer. Fortunately, we've made a lot of progress in HER2 positive disease. A lot of people start to think of inherited genetic mutation when they think of genes, but this HER2 positive breast cancer is not something that you can pass on to a child or you got from one of your parents. It is a mutation or a change in the tumor itself that makes it have too many copies of this gene. And then if you'll notice, there is another subtype. Oh, so before we leave HER2 positive, you'll see what's boxed here on the slide is that HER2 positive breast cancers can also co-express estrogen and progesterone receptors. We call those hormone receptor positive, HER2 positive tumors, or they cannot express hormone receptors. They're called hormone receptor negative, HER2 positive tumors. And then the last in the dark green are what we call the triple negative tumors. So they don't grow under the influence of estrogen or progesterone, and also HER2 is not over amplified, or 2 copies of this gene is not present. So we think of those tumors as ER negative, PR negative, meaning estrogen and progesterone receptor, and HER2 negative. So that's where the triple negative comes from. A small percentage is unknown, but that's pretty common. So I've already alluded to HER2 positive breast cancer. Human epidermal growth factor receptor 2 is a protein that's found on the surface of breast cancer cells. When the amounts are high, it causes the cancer cells to grow and multiply. And the reason that there are too much of this protein on the surface of the cell is because there are too many copies of this HER2 gene that's producing the protein. And because of that, it causes the cancer cell to divide uncontrollably and is a more aggressive subtype. But it's sort of a double-edged sword, because our greatest progress, or one of our major successes in all cancer diagnoses, is really in the understanding of how this gene has been linked to this aggressive subtype and being able to target it with multiple treatments. And so that's really improved our outcomes considerably. And as I pointed out earlier, our death rates are falling. And one of the reasons is really directly linked to this subtype of breast cancer where we've made so much progress. So here's a question that comes up quite a bit when someone is diagnosed. I mean, I do this every day, and this is very routine for me, but for someone who's going through this diagnosis and comes up with a new diagnosis, it's almost like you're learning a new language, and you're meeting all these new doctors and understanding who does what and who's kind of calling the shots. It can be really overwhelming, because in the center of all of this is you as the patient and having an understanding of who's on your team. I'm a medical oncologist. You see that in the light blue on the right-hand side. What I do is I give treatment that is either IV or oral, and I give what we call systemic therapies. These are treatments that go into your entire body to either decrease the risk of breast cancer coming back, or in the setting of stage 4 disease where it has already spread, to try to control it from spreading further and improving symptoms. A surgeon is intuitive what a surgeon does. There's a tumor in the breast and it needs to be removed, and lymph nodes under the arm are very often sampled because that's the way the cancer accesses the rest of the body. A radiation oncologist is a physician. They're not a radiologist. Patients tend to confuse this type of physician with a radiologist who reads like a CT scan or an X-ray, or even a breast radiologist who reads a mammogram or an ultrasound. These are physicians who deliver high-dose X-ray therapy to the breast in the setting of early stage breast cancer, or if cancer has spread. Sometimes it causes pain, like in the spine or in a hip area, and a radiation oncologist can deliver very focused X-ray therapy to that area to cause an improvement in symptoms. And of course, we have members of our support team, including our psychiatrists, our nutritionists, our exercise physiologists. We all work together as a team to develop a best treatment plan for you. So this is something that comes up and is often confused with grade, stage. There are 4 stages. There are 3 grades. So stage implies where is this cancer in the body. Stage 0 is a breast cancer that we call non-invasive. It's only within the duct or within the lobule of the breast. It hasn't gotten out of that area and gone into the breast tissue, formed a mass. Stage 1 is an invasive breast cancer that is in the breast. And then you see with stages 2 and 3, either the tumor is larger or it has traveled to lymph nodes or both. And then stage 4 is metastatic disease. It spread to a distant site. By distant, we mean distant from the breast. So the bone, the lung, the liver, the brain. Stage 4 may be diagnosed upfront, especially in someone who's not been going through screening mammograms. And sometimes, with COVID, a lot of women missed their mammogram. And unfortunately, we've seen a lot more later stage diagnoses as a result. So it's important to understand what your goals are for your treatment. And in the early stage setting, what we're attempting to do is remove that cancer from the breast and then give you treatment, if indicated, to prevent it from coming back. So as I mentioned, the surgeon would operate and remove the cancer. That could be with a mastectomy, which means the entire breast is removed, or it could be with just removing the tumor and a normal margin of tissue, breast tissue around the tumor. We call it a lumpectomy. The preventing recurrence part is where I come in. And in order to make a decision about what treatments need to be administered, I have to have an understanding of what is the risk of that cancer coming back. And a lot of that has to do with the size of the cancer and whether or not it went to lymph nodes. But it can also have to do with what subtype. I showed you the subtypes before: triple negative, hormone receptor positive, HER2 positive. So those characteristics of the tumor give us some information on prognosis and also treatment. And we use those therapies to try to prevent recurrence. In the situation where someone has a metastatic breast cancer, we call that stage 4 disease. Unfortunately, at present, that's not generally considered a curable situation, but it doesn't mean that it can't be treatable for many, many years. I've had patients with metastatic disease in my practice be alive and doing well with a good quality of life, some of them for like 10, 15 years. It's really something that has become a chronic illness. And as we start to get better at offering therapies that can control the disease while improving quality of life, we're extending survival even in metastatic breast cancer. And I always tell my patients, we have to continue to, have you do well and be around, because we don't know when there will come a time where we are actually able to cure metastatic breast cancer. So how does it become metastatic? It can go from the breast to other areas through lymph nodes, typically under the arm, or through the blood supply where there's cancer cells get into the blood vessels and then travel to a distant part of the body. Local metastases means spread to lymph nodes on the arm. Distant means to a distant site. In terms of the treatment goals for metastatic disease, as I mentioned, the first thing obviously we always want to do is allow our patients to be with us for as long as possible. So increasing overall survival, the total time living with metastatic breast cancer. We want you to, enjoy a longer time. And at that time, we also want that time to be valuable with a good quality of life. I don't know many people who would rather be around for an extra day if that day was a miserable one. And so we really do focus very much on making sure that we're not just allowing you to have more days, but have more quality days. And increasing progression-free survival, this is a term we use in cancer quite a bit. It has to do with the amount of time the cancer doesn't grow or spread while you're on a current treatment, and sort of putting that disease on pause and giving you a longer time where you're able to, again, not symptoms from the disease. You may have some additional goals that are not shown here, right? You may have a feeling that I don't care what treatment I take, but I don't want to lose my hair. Or, I had a patient once who was a piano player, and she said, I will take whatever you want. I'm very open. I want to be around, but you just can't give me anything that's going to cause me to lose the feeling in my fingers, because this is what I do for my enjoyment and for my work. I'm a piano player. And so in that situation, what goals are, it's really important to make sure that you voice those goals, because as your physician, we're not here to give you, a plan that doesn't incorporate, your wishes. That's something that you're part of the treatment team. Your opinion and what you feel is best for you has to really be heard. And if you don't feel you're being heard, I always think that that's a bit of a red flag, right? If your physician is talking over you, is not giving you a chance to get those thoughts out, or is not listening to you, it can happen. You need to feel comfortable with your team. There are a lot of us that take care of breast cancer patients, and there are a lot of physicians that are willing to see you and treat you in the way you deserve to be treated. What treatments are available for HER2-positive breast cancer? Well, the right treatment for you will depend on a variety of factors. Again, some of these are shown here, but HER2-directed therapies can be IV, they can be oral. Chemotherapy can be added to this what we call targeted treatment. And of course, if the tumor is also hormone receptor positive, about half of all HER2-positive breast cancers co-express the hormone receptors, then hormonal therapy in the pill form may also factor in. So here's a polling question. What is your top goal for breast cancer treatment? Controlling my symptoms, improving my quality of life, surviving as long as possible, preventing progression or recurrence, maintaining independence in daily activities like eating, bathing, dressing. So please vote. Okay, so this poll is now closed, and I will just comment that about 18% of you said improving my quality of life, 27% surviving as long as possible, 55% preventing progression or recurrence, and none of you said maintaining independence in daily activities. I would just comment that I think it's really hard for somebody to choose one of these goals. Obviously, we want to feel well. We want our patients to feel well. and have a good quality of life. And all of these things are really important. But I think the question is just meant to try to tease out for you what may be a more of a motivating factor. And again, as I mentioned, it's really important that your goals are voiced to your care team. The other thing I would say is some of my patients, I think, recognize the value of the entire team. So we have patient navigators, we have social workers, I have an excellent nurse practitioner, and sometimes, you know, I'm pulled in many directions, but my nurse practitioner may have some more time to chit chat with patients. And sometimes, you know, they tell my nurse practitioner a lot of information that we don't have time to go through. And use all members of your care team. We're all here to help you, and this is a team approach for sure. Okay, so now let's talk about advocating for yourself during your treatment journey. So here's where supportive care is really important, because I had a patient that I saw just yesterday in clinic, and she had a new breast cancer diagnosis, and a lot of women come to this with a lot of anxiety and, of course, a lot of fear, a lot of hesitation. And when we started going through things, she was just overwhelmed and turned to the point where she wasn't able to focus and she was crying. And I stopped in all of my explanations and I said to her, you know, out of everything I've told you, where are the tears coming from? I know it's tough because it's hard to pinpoint, but if there's one thing that's really just scaring you, can you tell me what it is so I can help you through it? And she said, I watched my mom die of metastatic breast cancer. She suffered a lot, and I don't want to feel sick. And I had to speak with her a lot about how things have changed, because her mom had breast cancer back in the 80s when our supportive treatments were not as strong as they are now. We have a lot of supportive treatments that allow our patients to get through a lot of really highly nauseating chemotherapy without the degree of nausea and vomiting we used to see. Gone are the days where people are throwing up in their bathroom over the toilet bowl for, you know, long periods of time. Nowadays, we have really good supportive therapies for nausea. Infection rates are down because we have growth factor support shots that can support your blood counts. We even have the ability to use cold caps so that chemotherapy doesn't cause hair loss. Of course, there are a variety of other things that can help your emotional well-being, like spiritual support, emotional support, counseling, nutrition counseling, meditation, yoga. The financial toxicities are real for these drugs. They're expensive, and having the support from not only whatever resources are local to you and other places like, you know, American Cancer Society, Susan Komen, all of those sort of patient resources, but just even pharmaceutical companies have a lot of financial support. So these are the progress. This is the progress we've made in supportive care, and it's defined here as healthcare that relieves symptoms caused by cancer or its treatment and improves quality of life. So please be sure to ask your healthcare team about supportive care services that are available and how to access them. It's, like I said, very normal to experience distress during cancer care. I don't think anyone is prepared to hear those words, you have cancer, and the diagnosis never comes at a good time for anyone. It's disrupting not only to the individual, but to the families, and it causes a lot of anxiety. As I mentioned, you know, I do this every day, but for an individual who's newly diagnosed, it really can pull the rug out from underneath you. And being able to recognize that and voice it and ask for help is really important. Distress is normal, but it makes it really hard. You know, another thing that's extremely hard for our patients is the waiting. So you get a biopsy and then you have to wait for the news. You have to wait for an additional biopsy, for an MRI. A lot of that is also associated with a lot of anxiety and distress. We call that scanxiety. So talk to your doctor and those who feel comfortable with about how you're feeling. Don't be ashamed or shy to ask for help. Of course, you know, we all have felt sad at times, but this is a situational issue for which we can provide you a lot of support. And information is power, right? I mean, I had a patient the other day who was so overwhelmed because she had a new breast cancer diagnosis, and she thought it was a situation where she didn't get to the operating room within the next week or two. She was in her mind thinking, this cancer is going to spread all over my body and I'm going to die. And I had to explain to her that she had a more slow growing hormonal cancer, not that we're not in a rush to take care of her. The feeling that was keeping her up at night was really not likely to happen. So being able to voice those concerns and have your physician take those seriously and address them is really important. Here, this slide is entitled Ensuring I Receive the Care I Need. Be sure to ask your healthcare team any questions you have about treatment options, clinical trials, side effects, routine office visits, who to call if you have questions or are experiencing adverse events. And here you see a lot of questions that come to mind. I think one of the worst parts during the pandemic was when patients would have to come to the office visit alone, because it was very sad to see them so overwhelmed and not have somebody as a second set of ears with them. It's important to bring someone with you. Hopefully you have someone, a friend, a family member, who can come in and take notes for you or just be there with you to make sure that you've understood everything, or be your advocate, speak up when you're maybe feeling overwhelmed. And making sure that you ask about patient resources for help, as shown here, home health care, transportation, and other services that can ease your burden. Always ask to speak with a social worker or a patient advocate who can help you understand your treatment plan. I have to tell you, you know, as a physician, one of the things that I'm always frustrated about is the fact that I wish I had more time with my patients, because we have a lot to get through. And there's no way that in 20 minutes that I'm in, or sometimes 30 minutes for a follow-up and an hour for a new patient, there's just way too much to go through in that time. I spend 2 or 3 hours with one individual to really make sure that they understand. Unfortunately, we don't have that time as physicians, but that doesn't mean that all of those questions are ours to answer, because that's where we come with the team approach, and we rely so much on our colleagues. So additional tips for communicating with your providers. I mentioned this. Bring a family member or a friend with you for support. Keep a list or a journal of your meds, concerns, questions, side effects. It's hard. You're overwhelmed. This is a new language for you. And you don't want to leave the office and then say, oh, I forgot to ask this, and then not understand how to get that information to your provider. I give all of my patients my direct email, and I say to them, you're going to leave and you're going to think of something that you forgot to ask me. So send me an email, as long as it doesn't become a huge back and forth, you know, big long emails with medical discussions. If it's a question that you forgot, can I take this supplement? You know, can I go and change my treatment visit to the following week because I have some important family event? Those are things that can easily be addressed and can help you with navigating your treatment plan. Ask your doctor to repeat, explain, or write information down for you. I try very hard to do the teach back method. I don't do all the talking. I explain something, I pause, I say, what did you understand from what I went through with you? Do you have a question about something I said? Pick up on social cues, right? If you see someone without understanding in their eyes, pause, stop. You look confused. Can I clarify something for you? Is there something you're not comfortable with that I told you? So recognizing that that's a relationship that you need to have a two-way conversation. Make sure to tell your about your preferences, beliefs, and concerns when you're making important healthcare decisions. Everybody receives information differently. I'm perhaps meeting you for the first time. I need to know your value system. So here there's a question. What tips or strategies do you have for advocating for yourself during your journey? I've done a lot of the talking. There's an opportunity to put some questions through the chat. Jill, has anything come through?
Nothing has come through yet.
Okay. Okay.
I'll let you know.
Okay, great. Feel free to interrupt me. I think we're going to also talk at the 15-minute mark here at 8:15, make sure that we have an opportunity to go through this tool, the Novellia, like a free tool like Novellia, to keep track of your healthcare records and all of your medications, concerns, questions, and side effects. And so you're going to hear more about that at the end, and it's really meant to be an additional tool to help you keep track of everything.
We did get one comment. Someone said, "Not be afraid to speak up is important when advocating for themselves."
I think that's such an important point. And, you know, I practice here in South Florida, and a lot of my patients are older, and they're of the generation where you don't question the doctor, right? The doctor told you to do something or to take a certain medication, and you just, you know, trust their judgment. I always tell my patients, I want you to feel empowered to challenge me, and not in a bad way. It's just, I want you to understand why I'm asking you to take something, because it's easy for me to write the prescription and you go home. But when you're having the side effects from that therapy, if you don't understand why I gave you that drug, or what the alternatives were, or what your risk of recurrence is, and you're not like bought into the fact that you need this medicine, you're not going to be motivated to continue it. So it's really important that you do speak up and ask me your questions. So I think that's a really important point. Thank you for whoever raised it.
Yeah. So someone mentioned writing down questions ahead of time as well.
Absolutely. It's a lot of information. It's totally overwhelming, and having a way to organize your thoughts and to journal those things. If something, I always tell my patients also, when they're having a lot of problems with anxiety and scary thoughts that are coming to them, keep, you know, a notepad by your bed at night. If you wake up in the middle of the night and you're so panicked because you're worried about something with regards to your breast cancer treatment, write it down. Show it to me. I want to help you have the comfort to go through all of those things and not have thoughts that may not really be grounded in reality. Sometimes your mind gets away from you. It's natural. So here's another polling question. What side effects of treatment do you have that are the most difficult to manage? Diarrhea, nausea and vomiting, rash, dermatologic effects, fatigue, hair loss. I think a lot of these side effects can be tough, right? I think this poll is still open, still waiting for some of you to answer. I know it's hard. Pick the one that you think would be the toughest. It also depends, of course, on what treatment you're on. Fatigue, 90% fatigue. Hair loss, this is an important one too. And as I mentioned, you know, now we have the cold caps for any of our patients. They take advantage of that, especially in the early stage setting. Fatigue is a tough one. It becomes like the chicken and the egg, because what happens is the only thing that's really been shown to be very helpful for cancer-related fatigue is exercise. But when you're so tired, it's hard to find the energy to exercise. So we say you want to build up to it, even if it means like now it's getting cooler outside, go out for a walk for 5-10 minutes and then build up to like a half an hour walk a few times a week, it does become challenging. Some of these medicines and the cancer diagnosis itself can cause a significant amount of fatigue. What's your top goal? Oh, okay, that was the last one. The question at the bottom, chat with us. What have you found helpful for managing side effects at home? Jill, anybody with comments?
Yeah, warm and hot baths at night.
Mm-hmm.
Something.
Yeah, that's a great one. It helps manage your mental anxiety and also can help relax muscles, help you feel better physically and emotionally, for sure.
Yeah, some people also said weighted blankets.
Mm-hmm.
And yoga.
Those are great suggestions. Yoga.
As well as good nutrition and rest.
Mm-hmm. Yeah. All great suggestions. So a lot of our patients are going through a lot of these treatments that have side effects that can be tough. Some of them are more lifestyle modifying than others. Like, for example, diarrhea. It's really hard. I had a patient just today who told me that for Thanksgiving, she was so looking forward to going on the trip, and she went to New Mexico. She was on the flight for like 4 or 5 hours, and she ended up in the bathroom in the plane, and she was really bothered by it. Of course, we all hate using the restroom on airplanes, but she thought that was really like the worst possible thing, and was so upset that happened to her on the plane, or not being able to leave the house because of having to be close to a restroom. Of course, the weight loss, weight gain, that can impact, especially for us as women. We tend to be very conscious of our weight. It can be hard. Joint pain is tough because, again, it happens where exercise can be really helpful, but it's hard to have the energy and the feeling of exercising when everything hurts. The sore mouth, there are a lot of mouthwashes and supportive therapies that we use, but even then, the sore mouth can be problematic. It can affect your ability to eat. Hair loss, we know, can be traumatic. Neuropathy, the numbness and tingling. I talked about my patient who was wanting to avoid that at all costs because she played the piano. And then all of these things that are shown here, especially, the fatigue we've talked about, that can be tough because you obviously want longer days, more days, but you want to be able to enjoy your time. Really tired and you don't have the energy to do anything. It can then lead to some depression also. So I think these are all really important side effects. So to help with fatigue, we talk about taking short naps or breaks and doing light exercise or walking each day, trying to stick to a schedule. The daytime naps become tough because if you take a lot of daytime naps, sometimes at night you have a problem falling asleep. Sometimes our patients become really, really exhausted and just are not able to function at all during the day, especially for metastatic patients. Sometimes we give them a little bit of Ritalin, and that can be really helpful to maintain their energy and focus during the day. That's as sort of a last resort. Of course, for diarrhea, a lot of our meds can cause diarrhea, and that can lead to dehydration, infection, and kidney problems. So some patients have this feeling like it just needs to go through them and they don't take anything. They think of it like as an infectious issue, like I've just got to get this out of me. And I tell patients, don't do that. That's a good way to end up in the hospital. This is a medication that is causing this and we need to stop it. You need to take the anti-diarrheal medicine as recommended by your physician. Let them know if it's not working. Make sure to stay well hydrated. Make sure to avoid your food triggers as shown here, especially dairy can be really tough if you're having diarrhea. For the nausea and vomiting, I think here's where we've made a lot of progress. Our antiemetics or our anti-nausea medicine has gotten a lot better than it used to in the old days. So making sure you're not eating big meals, using those meds as recommended by your physician, and sipping water throughout the day to avoid becoming dehydrated. Rash can be really troubling because obviously it's something that other people can see. A lot of our metastatic patients are doing so well, and they hear quite a bit when they go out, "Oh, I wouldn't even know you're sick." And that in itself is a comment that some people are bothered by, rightfully so. But in a way, it's also comforting to know that you don't, quote unquote, look sick. But when you have a rash or something so obvious like that, it does cause a lot of attention, and it can cause people to be a little bit self-conscious. So a lot of our drugs can cause rash, and we are able to treat that with either steroids, antihistamines, and then there are some lifestyle modifications that are shown here. A lot of our chemo drugs can cause chemosensitivity or sun sensitivity. And of course, practicing here in South Florida, we are always in the sun or have sun year round. I always tell patients, make sure even if you're driving in the car, you're going from one thing to the next, you're still getting sun exposure, wear some sunscreen, and make sure that you're taking appropriate measures. Neuropathy is a really tough one. This can be painful. It can cause you to not have the ability to do things like button your shirt. Your signature can look different. Opening a can, if you're having neuropathy in your feet, it can cause you to trip, not feel the gas pedal or the brake properly. This damage to the nerves that can happen from chemotherapy, it can start with like a pins and needles sensation, but then when it gets really bad, it can affect your fine motor ability, and it can cause burning pain and heat and cold sensitivity, especially at night. For some reason, it causes people to wake up, and it's really uncomfortable. Acupuncture can be really helpful. There are supplements that I usually recommend my patients to take, like glutamine and B6, alpha lipoic acid. Those regenerate nerves. There are also prescription drugs that are nerve medications that can help, and massage therapy and physical therapy can also be helpful. There are serious rare side effects, as shown here. Some of these can end you up in the hospital. Neutropenia means a low white blood cell count. That happens as a consequence of chemotherapy, and if it happens and you get an infection, that infection can get into your bloodstream, and you can end up in the hospital with really serious symptoms. Liver problems can happen as a consequence of some of our drugs, and just as a consequence of disease progression. Skin reactions, heart issues, lung problems, blood sugar, all of these are shown here. You need to be in touch and have a way to reach your physician if you're having some of these serious side effects. And during the teaching, for every new treatment that you're put on, make sure that you understand the top few side effects that you should really be watching for. As far as staying on track with your treatment plan, we have a polling question. What makes it hard to stick to your treatment plan? Side effects of the medications, high cost of the medication, forgetting to take your medication, unsure whether it's necessary, or just too many medicines. So please vote. I think we're probably waiting for a few more people because it's still not closed. Okay, side effects, more than half of you, 56%. One person said forgetting to take the meds. That can be helped with, apps and other resources. I think we're going to hear about some of that. Unsure why it's necessary. Well, that's something that I think really the onus is on the healthcare team to make sure that they're explaining the benefits of the medications. And if you're not sure, it's important to question your healthcare team. Too many medications, sometimes, unfortunately, I think it is a situation where some people need all of those medicines, but rightfully so. If you feel like you're taking too many drugs, maybe it's time to sit down and go through the reason for all of those. So I think there was a question on the bottom, but in the interest of time, does anybody have any other suggestions or comments rather about it, what else is making it hard to stick to your treatment plan outside of the things that we've highlighted here?
Yeah, someone said depression and anxiety impact every decision and action.
Of course, totally understandable. I think, again, it highlights the need to voice that to your healthcare team so that they know that you're not just not taking the meds because you just don't want to, you're not compliant, but you're struggling and you need help. And make sure that they understand that so that they get you the help you need. Okay, why is it important to stick to your treatment plan? Well, you can't benefit from a drug that you're not taking. That's the short of it. But even taking drugs inconsistently or discontinuation of your medications may impact how you do long term. And if you decide you're going to start doing things differently, just be honest and tell your doctor. I mean, you know, that I'd rather someone tell me I'm not going to take that, or I just don't understand, than me thinking that they're on the medicine and then maybe I'm not paying as close attention as far as every one of their symptoms, because if I know you're not on the medicine and you have a higher risk of recurrence, then when you call with a certain side effect, in the back of my mind, I'm going to think, well, her risk is higher. So, you know, it does impact how we receive information as well. And that information should be given without judgment, right? We're not here to tell you, you know, that there is a right or a wrong answer in every situation. Sometimes we have to incorporate a lot of various factors, and understanding that it's a discussion is really an important aspect of this. So I think this kind of takes us into our last slide, and then I'm going to turn it over to talk about the free app for tracking meds like the Novellia app, but there are other things that are listed as options. But establish a routine is important. If you have to set alarms, use pill boxes, keep it visible. I constantly forget to take my vitamin D, but never forget to drink my coffee. So I put my vitamin D next to my coffee maker in the morning, and you know, whatever it takes to keep you on track. Record each dose, and I won't read this to you word for word. Anybody want to comment about any pearls they've identified or tricks of the trade in terms of staying on track? Okay. All right. Sashi, I'm sorry I took 3 minutes of your time.
It's totally okay. I think the conversation and the comments coming in were really, really important and really interesting. So totally okay. Hi, everyone. I'm really excited to be here and to share a little bit more about Novellia. I'm guessing this is probably the first time many of you have heard of Novellia. And so I thought what could be helpful is to sort of begin with what is Novellia and why are we here? So Novellia is a relatively new smartphone app. It's a simple product. It's completely free. And we are on a mission to make it less scary and more manageable to live with cancer. And I'm here to walk through what we actually do and how we do it. So I want to begin with a story, and I'm sure this story is really relatable to many folks on this call. I want to introduce Anna. Now, Anna is a 43-year-old mother of two, and she's recently been diagnosed with HR positive, HER2 positive metastatic breast cancer. She's got so much on her mind in terms of what does this diagnosis mean? What does it mean for my kids? What does it mean for my health? And how am I actually going to go through managing this new change in my life? I think like so many folks on this call, Anna sees a lot of different doctors. She's got her main oncologist. She's also got her OB-GYN. She's got her PCP. Sometimes she pops into urgent care or a different clinic. But the challenge with this is she's generating a lot of data. And I saw in the chat earlier, I think Kate mentioned this, that being able to look at your medical chart is really helpful when you're trying to understand your health and your diagnosis, but more importantly, to prepare for what comes next. But the challenge for Anna, like so many people living with cancer, is that her health is all over the place. She's got different patient portals to log into. She's got a lot of manila folders with those printouts and lab results, and she's actually got cardboard boxes with tons of her health records. There's simply no way for her to easily understand what her health means. So Dr. Chen, who's Anna's oncologist, recommends that she signs up for Novellia. Now, what is Novellia? Novellia is a free all-in-one personal health record. What this means is that in the time it takes to brew a cup of coffee, and I heard Dr. Matani talk about her love of coffee. I actually love coffee as well, having some right now. In the time it takes you to brew a cup of coffee, you can sign up for Novellia. In fact, all it takes is your first and last name, the sex you were assigned at birth, your date of birth, and your address. And right now, to encourage folks to sign up, because it is a new product and it's not super well known, we're also offering $40 for folks to sign up for this product through this webinar, through this call. So it takes only 30 seconds and it's really simple and safe and secure to do. Once you actually sign up, here's what it looks like. So Anna has now registered for an account with Novellia. And all of a sudden, all of her health records from all of her different doctors over the years, over the past 10 years, are displayed in a very simple format in this Novellia portal. And she can see things like her doctor visits. So from now on, she doesn't have to rely on taking notes during appointments or trying to remember what was discussed. What you can see here is there's an example of a visit on August 1st of this year. So just this past summer. And there's a really simple reason for the visit, right? So her oncologist, Dr. Chen, is explaining why Anna was in the clinic and what they talked about. And if she's interested, she can click on any of the procedures that were done during that visit. On the right side, you'll also see documents, and this will include a summary of that appointment. So the notes that Dr. Chen is actually typing into his laptop will become available right here in the portal that Dr. Chen allows to sort of come through for Anna to look at. So this is a great way to not have to depend on your memory or your recall for what's actually being discussed during your appointments. In addition to this, it's really easy for Anna to now see changes to her vitals and her labs. So for example, how has my weight changed? How are my lab results changing? My blood pressure, my heart rate? But more importantly, she can see the results of the labs that she's getting prescribed and that she's getting recommended to take. Here's an example of a CBC that a lot of folks are familiar with. So instead of having to wait and track down those results from Quest Diagnostics, for example, or having to wait for those to arrive in your patient portal or picking them up at the hospital, Anna can just log into her Novellia portal, again, for free, and see those lab results the moment they become available. In addition to that, she can see all of her past lab results as well. Again, this is sort of a deeper dive into all of the lab results. You can see what doctor ordered which lab and when that was, and the purpose and sort of the results of those as well. This is a really important part of the portal, which is medication history. It's not that difficult for us to remember what medications we've been prescribed today, but sometimes it's really easy to forget what someone was prescribed a year ago or 2 years ago or 3 years ago. But in this simple medication tab, Anna can see all of the medications that she's taking today, including those that she was prescribed before. For example, here, she can see that she used to take pertuzumab, trastuzumab, and capecitabine previously, but now she's on a very different therapeutic. She can see when that different medicine started. She can see the dosage, and she can also see who prescribed that new treatment. Documents is a really exciting part of this portal as well. Again, I think it's really challenging for folks to have to remember every single thing that happens during a clinical appointment. It's difficult to know where those imaging results are from MRIs or CT chest scans. But here, Anna can actually scroll through almost like a calendar and say, oh, there was something that happened in July of this past year or in May. And she can click right into that and easily see the results of her imaging results or an IHC or encounter notes from her last medical appointment. But the goal here is to bring everything into one simple place for her to be able to look at. She can also look through any allergies that she has, whether those are to medications or to food items or to different things as well. And then finally, she can look at her immunization history. So here's an example of the COVID-19 booster. She can also tell if she received the influenza shot and a variety of other things as well. And this really helps her be able to participate in her care. So the next time she goes to see Dr. Chen, or if Dr. Chen retires or refers her to a different oncologist, Anna doesn't have to track down all of those records. She can open up Novellia right in front of her physician and say, you know what, I'm not sure if I was immunized for that. Give me a second. Let me go pull up my Novellia platform. And then she can see that she was actually given, for example, an updated COVID-19 booster on August 1st of this past year. So in a nutshell, what Novellia hopes to do is to really limit and decrease the level of fear, anxiety, and overwhelm that comes with having to manage something like living with cancer. The goal here is to make it really simple. So again, in the time it takes to go get a cup of coffee, all of those health records and all of those results over the past 10 years could be accessible right on your phone, which we hope sort of limits and decreases the burden of having to live with cancer as well.
Thank you.
Thank you. This was a great session.
Thanks so
Enjoyed
much,
it.
Have a great evening. Bye.
You too.